Okay, thank you very much for inviting me to come along and talk about a subject which is very close to my heart. I'm chair of Vision Northumberland, and I've worked in the sight loss sector for longer than I care to think about. I want to talk to you today about the causes, the impact, and what support there is locally for people with sight loss. So, yeah, understanding sight loss, definitions, the demographics of how it actually impacts in Northumberland, the everyday challenges, the support services, and the reasons why we need to raise awareness and promote inclusion. So the definitions. There are actually more than 13,000 people living in Northumberland with sight loss. This level of sight loss is severe enough to have a significant impact on their daily lives. On top of that, there are many more people with an eye condition that is at risk of developing into a sight loss that really is for them a problem. These include people who are registered who are sight impaired or severely sight impaired. But there are an awful lot of people who aren't registered as sight impaired and those are the people who particularly we are needing to reach. There are people who are waiting for treatment but haven't got to the point where they become registered. There are people whose sight loss could be improved by wearing correctly prescribed glasses. There are people who, because of their age, their sight is deteriorating and they just get used to getting nearer and nearer the television or giving up reading the newspaper, but don't recognise that their sight is as bad as there is. So 13,000 people, and we only know 2,000 maximum of those people. We have to think about those other people. The common causes of sight loss are, as you probably know, macular degeneration, the leading cause of sight loss, affecting the central part of the retina and impacting detailed vision. Again, that impacts on an awful lot of older people. Glaucoma, which causes damage to the optic nerve, often linked to raised eye pressure, leading to sight loss. Diabetic retinopathy, which results from blood pressure damage in the retina caused by the diabetes, that can have very serious effects on people's sight. And cataract, which are very common, causes clouding in people's eyes. If it can be treated, then the effect is really minimalised, but if untreated, there are real problems. So the trends and statistics in Northumberland show that there is a rising trend in sight loss cases, which mirrors national patterns. This is mainly because people are living longer. Not at least half, probably 3/4 of people over the age of 90 have severe sight loss. So you can see that as people are living longer, there are more people in the older age brackets, and therefore our numbers are actually going. But what is also shown is that although statistically we know those numbers are going up, we're not actually reaching any more people in Northumberland. We need the data to really help healthcare providers plan and improve community support services. But however, in this county, there is very little statistical evidence except for registration data, which does not include the majority of people with sight loss. And therefore, people who are commissioning services don't have the evidence to plan for effective services. So the demographics of people in Northumberland. The age groups most affected, of course, are older adults. Older adults are the largest group impacted by sight loss due to the common age-related eye conditions. Younger people with sight loss are usually congenitally or acquired sight loss and uniquely require specialist support I must say here, in the last 2 days, I've had contact from 2 social workers within the council, both looking for support for younger people with sight loss, who also have additional disabilities. And especially in the county like Northumberland, to deliver services to actually a very small proportion of people, but who live all over 200 square miles of Northumberland, is not easy. So the geographical distribution within Northumberland, we've mentioned the variations. I think the problem that we face here in this county is the geography, the access to services, the access to vision care and sports services varies significantly by locations within Northumberland. There are considerable barriers to accessing services depending not only on where you live, but also the availability of public transport. One of the problems, obviously, that vision impaired people have is that they can't drive. They can live several miles, I say miles. If you live in Berwick and the service happens to be in Newcastle, you've got a round journey of nearly 200 miles to get to any health services. The access to services and local services for local people are really important. And that impacts on the quality of people's lives. Social economic risks are also a factor. Evidence shows that lower socioeconomic status increases the risk of sight loss due to limited access to healthcare and resources. So it's important that those barriers are actually addressed. The health and social care inequalities for people with sight loss are very much around how they're able to access those services. If services are online, that makes it much more difficult because people with sight loss have difficulty in accessing online services. If they live in rural, remote areas of Northumberland, it can be that their internet services are not as good as they are in other parts of the county. We really need to address the health inequalities and make sure that those are really reduced for people with sight loss. So the everyday challenges faced for people with sight loss, inadequate signage, poor lighting, obstacles, getting around in public spaces, really makes life very difficult for visually impaired people. We need to be promoting accessibility for people with sight loss and make sure that they have the confidence to get out and about and do the things they want to do. There are real barriers to employment and education. If you look at the statistics, for visually impaired people who are in work, there are less visually impaired people in work than any other group of people with disabilities. And if you equate that then to people who don't have disabilities, visually impaired people are really, really excluded. There's lots of reasons to that. I think there's very much a lack of understanding with employers about how they would benefit from employing a person with sight loss, or the employer's understanding of all the support that should be out there to support them employing a person with sight loss. The same things go around the educational barriers, limited learning opportunities for people with sight loss. Again, we go back to a lot of people with sight loss are not known to the system, and perhaps those people don't even recognise themselves how inadequate their sight actually is. We need to break down those barriers that stop people doing the things that everybody else is able to do. Mental health and social isolation is a real problem. Sight loss often leads to feelings of loneliness and anxiety, and that leads to fewer social interactions and communication challenges. It's something that is really made even worse if people live in remote rural areas. because their neighbours are perhaps further away, that the other people with sight loss are further away. They very much feel that people don't understand how they feel as people with sight loss. And that impacts on people's mental health. It increases the risk of depression and emotional distress among people with sight loss. So mental health support is essential alongside physical assistance to improve people's well-being and help them understand themselves how they can better cope with their disability. Digital inclusion, it disproportionately affects people with sight loss. The lack of access to technology is a real problem. The inaccessibility of websites and online contacts, and the problem they themselves have of being able to use the skills that they need to actually access the internet and use the internet. Added to that is the high cost of special equipment that is needed. But it's essential that we do break down those barriers, because more and more, everything that we do in our everyday lives expects people to be able to log on to gov.uk or the NHSX, or we need it to get onto the local authority website, we need it to access so much, and vision people at the moment are really excluded from that. So support services in Northumberland. Vision Northumberland, which is the organisation I'm working with, offers a low vision pathway, which is an initial assessment, a specialist assessment, a very person-centred assessment, which leads to advice and information, hands-on demonstration of the wide range of equipment that is available, emotional support and counselling, meeting with lots of other vision impaired people in the same boat, signposting to other services, and various, I'm saying courses, but very much they're very person-centred groups that work together with vision impaired people to help them understand and appreciate how they can enjoy life to the full. We have social activities, we have peer support groups and activities across the county, which encourage community engagement and reduce isolation. And we have a Client Connect befriending service, which at the moment is reaching over 200 people across the county. Assistive technology and accessibility measures is absolutely prime in what we are needing to do. There's so much that is now out there to help vision impaired people, and it's changing every day. We've got screen readers that convert text to speech. We've got magnifying tools in large text and images. We've got so many apps that are developing day after day after day that are on mobile phones that help people navigate. I'm sure a lot of you know about sat-navs to help you get places in the car. Well, there are apps that use exactly the same technology that help vision impaired people get around the world that they live in. And then there are local training initiatives that help people learn to use the technology. We at the moment are launching a digital enabling service where we will be going out across the county talking to people everywhere about the apps that are available to help them do the things that they couldn't do. For instance, there is an app that you can take into the supermarket with you, point at whatever it is that you want to buy. It will tell you exactly what's in it. It will tell you exactly what the price is, etc., etc., and it will talk to you. So yeah, it is changing day by day. So Vision Northumberland is based in Morpeth, but delivers outreach services across the county. And in exception, we'll actually come out and provide a home visit as well. We offer volunteer driver service, which means that we can help people access services, and we can also access community transport providers. In a county like Northumberland, it's absolutely essential we recognise that people are able to get to the services. It's part of what we do to ensure that that support is possible. There are other health and social care providers, so we work together with the various providers. We work together with the council. They hold a register of people who are blind and partially sighted in the county. This information is passed on annually to the Department of Health. But as I say, that register is only a small picture of the people who live in the county who are severely sight impaired. BID, the Birmingham Institute for the Deaf, offer an assessment and rehabilitation service. That is part of what the council legally have to offer as their service to people who are registered as blind in the county. And then there is continuous ongoing support from various organisations, Age UK in Northumberland, the CAB. We work together with a whole range of services to ensure that people get the best service possible. What is really important is raising awareness. So public awareness campaigns in Northumberland, educating about sight loss, which is probably why I'm talking to everybody today. We need to be focusing on helping the public understand the challenges faced by people, helping the public understand that there are so many more people out there with sight loss that we don't know about. We need people's neighbours, we need people's friends, we need people's relations to think, especially with older people, it's almost inevitable that a lot of older people will have significant sight loss. But those people, a lot of them are not getting the support they need. We need to be promoting empathy and compassion towards individuals who experience sight loss. There's so many of those people. It's not unusual. We just need to be out there and ensuring that everybody appreciates their need. One of the things that I have learned over the years, vision impaired people themselves are their worst enemies. They don't actually tell anybody that they've got sight loss. So they could go to their doctor and assume that their doctor knows that they're vision impaired. Their doctor doesn't always know that they're vision impaired. So the person themselves needs to be telling their doctor, they need to be telling their support worker, they need to be telling their neighbours, they need to be telling their relations that they're not seeing too well. We need to make efforts to boost the use of the available sort services out there. It's rather frustrating knowing that there's so many people out there who, if they were accessing the support that is available, would be living much more enjoyable, happy, healthy, safe lives. We need to ensure that we also get as many volunteers as we possibly can to train them and support them to help us in our work. So priorities for supporting people with sight loss in the future is about reaching more people. The sooner we reach people or people find us, the more likely it is that they'll be able to live safely and happily. We know that the more people get used to living the way they are, then it is even more difficult for them to adapt to new ideas, to new technology. We need to reach people very early on in their sight loss journey. We need to bring services much nearer to the people. We need to ensure that services that are only available in Newcastle need to come much nearer to people. We need to, as an organisation, need to take our services more out of Morpeth and make sure they're available in Berwick and available in Hawtwistle and available in Hexham and available where I actually live, which is in Kilda. We need to take their services out to the people as much as we possibly can. We need to integrate health and social care services, join up health and social care so that people are just getting that one pathway to their independence. We need to raise awareness and understanding people. We need to be fighting to improve accessibility. That's something that I know vision impaired people themselves are very passionate about, improving accessibility in public spaces. I remember a long time ago, there was a campaign to stop people riding bikes on pavements. We've still got that problem. Vision impaired people live with it, but it's not easy. There's been a campaign recently about electric cars. Vision impaired people can't hear electric cars, and there was a campaign to raise awareness so that electric cars had a built-in noise in them. We need to strengthen the networks that we've got in Northumberland to ensure that we're able to deliver the best possible service. We need to be offering people genuine choice rather than us making decisions for people. Give them choice of what service they would like, where they would like it, how they would like it, what's right for them. So the challenges create complex situations which affect individuals and communities and delivering services in Northumberland. Importance of raising awareness is absolutely essential. There's so many people that are missing out on services because people just aren't aware. And inclusivity, really important. We need to ensure that vision impaired people are able to be more included in absolutely everything that's out there for them. So thank you very much for listening to me. On the screen now is our contact details, and this will be up on the website anyway. I like the little man. I nicked him from somewhere. Well, thank you very much for listening. I'll hand you back now for questions.
Thanks for that, Sue. It's a really, really good overview of not only, sort of obviously your services, but also some of the challenges that are, sort of faced by people with sight loss. So whilst we're waiting for some questions to come in, please do pop those in the chat box. I guess I just had a question around, really interested to kind of hear a little bit more about your sort of support services, in particular things like the volunteer transport. I guess that's kind of going to, sort of depend on, sort of like demand, capacity and things like that. But does the volunteer transport service work to get people to your own kind of social gatherings of support, or is it more general than that and it can kind of help with things like sort of appointments?
Yeah, we've got nearly 100 volunteer drivers across the county. Wow. And yes, they are there to bring people into our services in Morpeth, but we also are able to help them with appointments they have with their GPs or appointments they have with the eye hospital in Newcastle. So yes, it's quite a wide ranging service that we provide. It is very well used. In fact, we are looking at developing our capacity because without that support, we just wouldn't be able to do anything to cover the 2,000 square miles of the county. Our problem, of course, as you said, is those drivers live in specific bits of the county. So we've got drivers who deliver all over the place, but they're only in one place at one time. And so matching, say, a volunteer driver who lives in Berwick, you can't really match him with somebody who happens to live in Hawkwhistle. So coordinating it is very complicated. We have an absolutely brilliant volunteer coordinator, Rachel, who does a brilliant job. And I sometimes sit in our office and I see her interacting with the volunteer drivers, and it is absolutely great to see. The drivers themselves are so caring and understanding of people's sight loss. It's absolutely essential. We're looking to develop a travel buddy scheme because the volunteer driver scheme is totally at capacity. And we know if I'm saying I need to reach the 13,000 people, we need more volunteers. Yeah.
Yeah, and if there's anything that anyone on this call can do to, sort of promote, sort of volunteering, then how would they do that? Would they just sort of encourage people to get in contact with
Get in touch with our office in Morpeth. We're able, obviously, we pay volunteer expenses. We also do some really, really good training to ensure that the people understand the sight loss, know how to guide visually impaired people, etc., etc. Yeah, please volunteer.
Yeah, thanks for that. So there's a couple of questions that have come in, so we'll just go through that. Someone's asking about diabetic patients who are struggling with managing medications. Are there any services that can advise and support them with this, please? Is that in relation to sort of the eye conditions, or would you have any insight on that, Sue?
Well, I think managing the medications around diabetes will very much be around the special equipment that's available to help people to actually see how they can cope with
Right.
the equipment.
Yeah.
Interestingly, we do regularly, several times a week actually, have the diabetic eye clinic sitting in our office delivering service to people with diabetes in our centre. So I think I very much appreciate their problems. And again, the special equipment that people with diabetes have, it is improving dramatically day by day. What we can do is offer them support on how to use that equipment, just as we would have people support with magnifiers or whatever. Yeah.
Yeah, so people can, sort of direct to yourselves. And is there sort of a role, I guess, for like more engagement with those, sort of services supporting people with diabetes so that they can obviously, sort of signpost and people,
There's,
because it must be a regular, sort of issue.
there is a key link. I sometimes get frustrated. I see the people waiting to go to the diabetic eye clinic, and I wonder whether or not they actually know what we do. So very much we need to firm up referral pathways. For instance, if I look at our referral pathways, we get very, very few referrals from organisations providing services to older people,
Right.
especially support workers in older people's homes. We don't get them. We get very few referrals from care homes.
Hmm.
And yet it's almost inevitable that an awful lot of people in care homes have got some significant sight loss.
Yeah. And if you could get out into the care homes and use some of those sort of technological advances, even with the staff
That's
and
right.
sort of other
Yeah,
people, then that would be real, sort of benefit.
it'll make a
I
difference.
guess it's there's so much work to do, isn't there? And there's so much good stuff going on, but actually, sort of
It's how
expanding on
you do
that
it.
is, yeah, exactly.
Yes.
There's a couple of other questions. Does Vision Northumberland network with opticians to identify people who might need additional support? Do opticians provide any pro bono support to reach communities? I don't know if that's something that you would be able to answer
That is a
directly to,
very
or
good question. I've been talking with other organisations like Vision Northumberland across the country. The geography of Northumberland is almost unique, but not totally unique. In actual fact, if you look at some other counties that have got similar geographical problems to us, the majority of referrals into the eye care services come from high street opticians.
right?
So that doesn't happen in Northumberland, but we are determined now to strengthen our links with opticians and get that link, because I very much appreciate all the work opticians do. We can add value to what
Yeah,
they do, and we need to make that link. And so I'm looking to develop those pathways. I'm looking to develop those pathways into social prescribers as well. So social prescribers probably know what we do on the tin, but they probably don't appreciate some of the finer bits, the 13,000 people across the county, the fact
yeah,
that we're talking about an awful lot of older people, and we're talking about confidence and self-esteem and emotional support and social integration.
And there's a lot of unmet need, isn't there, as you
There's a
say,
lot of unmet need, and it's
and when you
made.
look at how many people you're supporting and how many people,
Yeah.
across the
And,
county. I'm sure
and
there's
I,
probably social prescribers on this call now, actually, so I'm
yeah,
sure this will be really, really
yeah,
useful for
yeah.
them.
And I saw Hugh put on about pharmacists as well. That is a link that we need to develop as well.
Yeah.
And yeah, I mean, we can't do it all by ourselves, but yes,
No, no, that's right. But I guess part of the idea about these, sort of online sessions is hopefully, sort of spreading the word further can only help. There's
that's
another
right.
question on there about the NHS apps. A really good point about the NHS apps. My mother has macular degeneration and struggled to read the letters they send through. Is
Yeah.
there any way to make the app read out the letters, or have you heard something that would do this in future?
I think I'm hopeless at technology, but I think there is. So in what you or your mother needs to do is get in touch with my office and say that you've heard me saying that. Yeah, I'm sure with well, probably with an iPhone or something like that, you can make them talk.
Yeah, there'll be some way of doing it. And I guess you've got people within your office who will know, sort of more about those
How to do it?
technological side of it that can kind of
Oh,
help support people
yeah,
around it.
yeah.
Brilliant. And someone who's saying they have someone they're working with who's had a stroke impacted on vision and ability to read, write, use mobile phone, would benefit from the service, but only willing to consider if a home assessment due to issues around transport. Would that be classed as kind of like sort of an exceptional circumstance, or can you give a bit more information about, sort of what would be considered an exceptional circumstance?
We'd explore all options before we would do a home visit because everybody wants a home visit. So, yes, we would offer transport to get the person into our office in Morpeth. We would offer accessible transport to get the person into Morpeth. If we would explore options for family or friends or whatever, getting into Morpeth. If in exceptions none of that was possible, we would send somebody out.
So perhaps the best thing to do is to put you in contact or
Yeah,
ask, sort of,
yeah,
yeah, can we do that? And then
yeah.
obviously we can have kind of some further conversations around that.
Interestingly, you hit there. Sight loss is quite a common side effect of people with strokes, and again, that is something that is not generally recognised.
Mhm.
Quite often, the sight can improve over time, but yeah, we need to make those links.
Oh, definitely. So let's have a little look. Someone just saying that a resident Slaley's been championing, can't say that, has been championing new laws to prevent people parking on pavements. Do we know anything about whether, sort of like Northumberland, I guess, sort of is anything going on, sort of with that around Northumberland that you're aware of?
We work close. There is in Northumberland a sight loss council, which is a group
Yeah.
of visually impaired people, and they are continually working with the council, with transport providers, etc., etc., etc. I think it's a problem. It's a problem absolutely everywhere. It doesn't only affect visually impaired people. It affects young parents with buggies. It affects so many people. It's all we can do is an ongoing campaign to raise awareness of the issues that it raises, and we will continue to do that.
Yeah. No, that's great. Thank you for that. So obviously, there's just a comment there about how pharmacists should be able to supply large print labels or large print information leaflets on request as well. Um,
Interestingly, pharmacists used to only think that if they did it in Braille, that was it. But in
right.
actual fact, the number of people who read Braille is diminishing so
Yeah.
much because of the difference in technology. So yeah, pharmacists need to think about it.
Yeah, to
Again,
kind of catch up with that.
yeah, but our service users need to ask for it as well.
Yeah. No, definitely. There's a suggestion there around the volunteer passport through the Thriving Together network. Might be an opportunity for
Yeah.
increasing volunteers. The link
Absolutely.
is there. So, but if you're not aware of it, we can obviously get that sent on afterwards as well. We have a comment about Northumberland libraries are trying to establish 2 new audiobook groups at Cramlington and Blythe. Just saying that if anyone's interested, there's an email address there. So that would be really, really helpful. And also organising Vision Zone events, which there's some information there about Vision Zone events in Ashington, Berwick, Hexham. What we'll maybe do is get some of that information together to send on with the slides and everything afterwards so that people who are attending here, just in case I don't pick it up out the chat, we can get that sent on via email as well. Um, Also working in partnership with RNIB to give away Envoy Connect devices free of charge, which allows them to download audiobooks from the reading services, which is great. There's a couple of other comments there. Someone's saying about software from a company called Synaptic. Software is adapted to read everything on the phone and iPad from text to web pages. Is that something that you're familiar with, Sue, in terms of technology?
We're very familiar with it. One of the problems is around the cost of the equipment. This special technology for visually impaired people, for better or worse, continues to be very expensive. But there are alternatives. In our office, actually, Synaptics, we have several demonstration bits of equipment which we do show to people, and really they're not expensive. But the special software for visually impaired people continues to be very expensive. The manufacturer's reason is there aren't that many visually impaired people out there. Therefore, the cost of producing it apparently is expensive. People don't realise that Microsoft actually produce a lot of the stuff that they need for free. You just need to know how to actually use it on the computer. But as I say, it's changing day by day, and the needs of people are changing day by day as well.
Yeah, sometimes it's about awareness, isn't it? Because I know when we did a piece of work around looking at kind of GP websites, until you kind of go on them and start kind of fiddling about with accessibility tools, you're not
Yes,
necessarily aware that you can do things
and
that
do that.
read to you, and you can do it on your emails. And obviously, because it's
That's
not
right.
needed, you don't think about it. But actually, if
Yep.
people were, aware that, as you say, it could really, sort of help,
Yeah,
and maybe they might
yeah.
not need those more expensive tools.
On a
Um,
mobile phone, you get the choice of having a small, medium, or large. How many people actually choose the large option?
hmm No, definitely. That's great. There's a few more. I guess it's just a question around referrals. Obviously, you've got your contact details, sort of on that.
And
Is
it's
that
one,
the best way to make referrals? Is it through
yes, it is.
Frontline? Is it through sort of different?
You can do it through our website or by phoning the Morpeth office. Yes.
Great. That would be fantastic. Was your contact details, Sue, in the contact details was on the presentation, isn't it? For
Yes,
people to get in contact. Yeah,
sure.
that's great. And someone saying that it would be great to agree, sort of a meetup, leading on useful vision, which is predominantly for children, but
Yes,
struggling to reach families in Northumberland. Um,
absolutely.
Tim's just put something down. Perhaps what we'll do then, if it's okay, can we make just a few link ups, sort of afterwards directly? Is that okay? So we'll make one with
Sure.
yourself and Becky, and we'll make one with Emma as well. And then yeah, we'll
Sure.
make sure that
Yep,
everybody who needs to be sort of in contact are in contact
absolutely.
directly. Let's have a look. We've got a comment just around the cost of prescription lenses becoming prohibitively expensive. Is there evidence that people are avoiding attending opticians because of, sort of cost?
I don't know if there's evidence, but my instinct tells me that people know that if they go to the opticians, they are inevitably going to be involved in cost. And for some people, that is a problem. it's going to be interesting when the government brings in its new laws about older people having to have eye tests every 3 years.
Right.
Yeah.
Okay. That's potentially an extra, yeah, extra costs as well. So, I'm wondering just if there's any further kind of last minute questions. There's been quite a few, so we'll just make sure that we just kind of review them. And if there's anything you don't think's been covered and you'd like to know, please do pop those in the chat box. I know your website's incredibly, sort of detailed as well. So there's quite a lot of information in there, isn't there, about, sort of the different support that you have, so people can, sort of go on
Yeah,
the website and have a little look, sort of at what else, sort of is there. And obviously, I'm sure that you're welcome, sort of any referrals to give some further
absolutely.
support.
Yeah,
Yeah, it's just a few comments kind of coming in to say that's, sort of really helpful. So whilst I'm seeing if anything further is coming in, I'd like to thank you, Sue, for coming along to talk to us today. And thank you to everybody else for coming along and listening. As you know, we do these sessions every month, so please do keep an eye out for our future presentations. And yes, if you need anything else, or if there's questions that you haven't kind of thought of, in this session, but you'd like to know, then please do contact Vision Northumberland afterwards, or, indeed, contact us at Healthwatch Northumberland, and we'll make sure that we get you, sort of like an answer. And yeah, we'll put those people in contact who need to be. And yes, we've just had a, sort of a mention there about someone who's at the council's public health team working on a needs assessment on vision loss. So there's an open invitation there to kind of provide any input. So thanks very much, everybody, for coming along today, and I hope that you have a lovely weekend all.